So, I'm sure you've heard about psychedelics before, and that's what I want us to discuss on our health and wellness feature this morning, the pros and cons of using psychedelics. Because we've got modern psychiatry that has transformed, right? It's transformed the treatment of many mental health conditions, people living with treatment resistant depression, PTSD, and other psychiatric disorders often continue to respond poorly to conventional treatment. And this has pushed researchers to look again at psychedelic assisted therapies, which can be used alongside psychotherapy in controlled clinical settings as much as possible. In fact, there was a 2026 review in Nature Medicine which pointed to rapid progress in the field, but its authors are clear that more high quality research is still needed to establish safety, effectiveness, and where these therapists actually fit in psychiatric care. But with nearly 1 in 7 people worldwide living with a mental disorder and many still without access to effective care, is psychedelic assisted therapy a genuine breakthrough for people who've run out of options? Or is it the excitement really problematic because it's ahead of the evidence? Let me know what your interaction or experience with psychedelics has been. Have you ever used psychedelics before? How was your experience of them? And what did you use them for? 011 883 0702, WhatsApp's on 072 702 1702. Dr. Kevin Stoloff is a specialist psychiatrist who's going to guide us through this conversation. Thank you for your time, Dr. Stoloff. Good morning.
Good morning, and thank you for having me on the show. I feel deeply privileged, mostly because I love to talk about mental health.
Yeah.
So thanks for the opportunity.
What exactly is psychedelic assisted therapy, and how is it different from simply just taking a psychedelic substance?
Right. That is a superb question because I think that we believe in the medical fraternity that, in fact, psychedelics and psychotherapy must go hand in hand if they're going to be therapeutic. I suppose I better start off with talking about what are psychedelics. And just to be brief, psychedelics originally came from the term mind manifesting. And essentially, these they refer to substances which change the way you feel in quite a dramatic way. So they might change your perceptions, they might change your emotions and your behavior and your sense of reality. So psychedelics, when taken sort of out of the room, as it were, out of the therapy room, people can have all sorts of different experiences which might render them vulnerable to decisions which are inappropriate. They might put themselves at risk. And so psychedelic-assisted psychotherapy is very different in the sense that it's in a room with a professional, and it is usually preceded, at least the treatment is preceded by a number of therapy sessions which prepare the person for the experience he or she is going to have. And then there's the experience, or the so-called medicine session, or there might be up to 3 spaced apart. And usually within that, there is psychotherapy going on between the patient and the therapist. And then thereafter, most importantly, there are integration sessions where the unconscious material that has come up during the session is processed and integrated so that somebody can take that and use that in his or her life.
Interesting. Do we have research? Because it looks like there's quite scant research when it comes to these psychedelic assisted therapy. In fact, just work around psychedelics. So, from your observation, are you finding that this is becoming more and more helpful to people who are struggling with some mental disorders?
Yes, I say yes cautiously because it is the case. But in fact, I would argue that actually there is much research having gone on in the last 10 or more years about psychedelics. And really it's important to understand that, psychedelics, I suppose the difficulty in South Africa is that a lot of European research, for example, in England and America, doesn't make sense in terms of South Africans and our socioeconomic climate or our socioeconomic situation. So it's difficult to say. So it's going to make a big difference in terms of 2 things. One, from psychedelics, we can extrapolate where emotions are sitting in the brain and where different experiences are sitting in the brain. So they're teaching us and scientists about about the brain and how it works, and about consciousness. So that's the one aspect. And on the other hand, from psychedelics, if the therapy is accompanying it, people can have a different sort of wellness where instead of the usual psychiatric medicines which block or blunt or a bit like, on an antidepressant, although they're life-saving, it's a bit like walking around like a Michelin man and where you're knocking into things which don't hurt. At the same time, you're not feeling the beautiful breeze on your face. And so psychedelics offer a different experience, a different sort of wellness. And people that have benefit from it say that they feel a wellness that they've never felt before. Those are the people that feel that they've had a benefit from it. So it's really something that is relatively new in terms of once upon a time in the 70s, before Nixon banned them, there was huge amounts of research which people forgot about. They were using LSD for alcoholism, etc. And then there was the great clampdown. And only recently, in the last 10 or 15 years, has there been a renewed interest in taking up those studies and looking at these substances more deeply and carefully.
I want to go back to the substances, Dr. Stoloff, because we may be moving too fast for some people here. How would you then describe like the psychedelics? Like, is it because there's too many elements involved, right? Some people want to know: are we talking about mushroom? Are we talking about weed infused, like gummies, or what are we talking about here?
Yeah. So I thought about that question because I thought I'd be asked it, and I think it's important to understand. It's important to understand that people can have this. What does psychedelic mean? I mean, if you look through a kaleidoscope, you remember looking through a kaleidoscope when you were little, or maybe not little, and light seems to fragment in all different directions, right? So that would be a kind of psychedelic experience, just looking through that. Because an example of a type of psychedelic experience you might have on a psychedelic. Now, cannabis can do similar things to people. And so they would say that cannabis has some psychedelic effects.
Okay.
However, actual psychedelics are termed classic psychedelics. And the classic means that it's a pharmacological categorization. So it's the 3 or 4 substances that work at a particular receptor on the brain that make them official classic psychedelics, if you know what I mean. So that's a pharmacological classification. And that includes psilocybin mushrooms. It includes LSD. It includes DMT. And that includes, various other, and mescaline, for example. So those are the most common 4 classic psychedelics we talk about. And then cannabis, albeit that it gives you some psychedelic effects, is not a proper psychedelic, as it were. I hope that helps.
Yes, very helpful. What are the real risks? Any side effects, limitations that people should know of? Like, who should this not be considered for?
Yeah. So your question is really pertinent because I think that we know that people with a history of psychosis, whether or not it's schizophrenia or bipolar type 1, in which people can have psychotic symptoms, or in fact, people who have first-degree relatives. So, for example, a mother or a father or a brother or a sister who's had schizophrenia, those people would be very, very ill-informed to take psychedelics because they're much more likely than others to have a kind of psychotic-like experience or a prolonged psychosis as a consequence of taking a psychedelic. So that's an absolute contraindication as far as I'm concerned.
Okay.
Apart from that, there are certain people who have quite fractured personalities. And I say that because it's a way of talking about people who have been traumatized, perhaps from childhood sexual abuse and other, childhood trauma. And people, unless they were being managed in a very, very carefully psychedelic-assisted therapy program, they would also be vulnerable to having difficult experiences on psychedelics. But it's not impossible for those people to have as long as there's an experienced therapist. And of course, there's the legality about it, and that needs to be brought up, and what is prohibited and what is not in South Africa.
Are there any clinical safeguards that need to be in for psychedelics to be used responsibly?
Well, so this is a very good question. Why I say that is because it's very difficult. We as psychiatrists in South Africa are not meant to speak about substances that are illegal. And so the problem is that on the ground, I have in my practice people coming from all walks of life, even some parents of teenagers saying, I don't want my child to be on Prozac anymore. Please, can she microdose magic mushrooms? And so for me, the most important thing about making it safe is to be able to give information in order to reduce harm. And unfortunately, when we're prevented from it being okay to give information, because it's deemed as giving permission, then we're in trouble, because then people go away with no sense of what is harmful and what is not. So I think the conversation has to begin with educating people about the harms, because people can really do what they want. And we live in a free society. But they need to know what's harmful to themselves and or others.
Yeah, yeah. I've got some questions coming through on 072 702 1702.
Hi, Clement. I
Hello.
just have one weird question. If you take or you go on the experience of psychedelics, when you do your medicals for work, will it be picked up as a drug, like how weed would be picked up? Thank you for the lovely show, Lee Centurion.
Oh, thank you, Lee, for that question. Dr. Stoloff?
Yes, when you say your medical, you're talking about blood tests or urine tests.
Let's say both, because companies do it differently. Some companies take blood tests, some companies mostly it's urine.
Yeah. So there's, say for example, if somebody's trying to test for something, one can't just use one test and say test for everything. You have to be testing for specific substances, even though you can test for multiple in one test. So in urine, for example, the 12-strip test that comes from Europe and America, there is not really a psychedelic strip for that. So you won't pick up psilocybin, you won't pick up LSD, and you won't pick up mescaline or DMT. You could do it if it was a specialized lab, if they were specifically testing for it in blood. But the other way to test for psychedelics is that there's the hair follicle test, which is another whole story. And if it's just a company medical, psychedelics won't be picked up. And I'm talking specifically about the ones that I've termed classic psychedelics.
Yeah.
Ketamine is an important consideration here, because this is the legal psychedelic that we use to treat treatment-resistant depression. That can be tested for by in urine and in blood, if it was requested by the insurance company. But it's not something that's routinely done. I hope that answers your question.
Yeah, no, thank you. And then Deboho on the WhatsApp line is asking, hey, Clement, please can you ask Dr. Stoloff there, what is the risk of psychosis after consuming such drugs or being involved in the psychedelic-assisted therapy?
Well, there's a kind of standard answer we'd give. So I would say that if you line up 100 people, one of those persons is probably going to develop a serious mental illness like schizophrenia. Now, in the very same way, if you give 100 people, even if it's in a therapeutic place, psychedelics, one of those 100 potentially could develop a prolonged psychosis. So it's very low. But the secret is in the history, the family history, and that is not always evident. So I suppose it's about 1%, so 1 in 100.
Okay. And for those who may be lost, when we talk about psychosis, what do we mean?
Okay. So psychosis really is, people like to talk about out of touch with reality when they talk about psychosis. And what it means is that people who believe certain things that are not true, for example, their phone has been spiked, AI is spying on them, people who feel they're being followed and paranoid, people who have hallucinations, for example, voices that are saying bad things about them, and people who are disorganized in their thinking. So that is a psychotic episode. And people whose judgment is impaired, and people's sense of reality is very different from the person next to him or her who doesn't have psychosis.
Got it.
So it's important to understand that psychosis is a cluster of symptoms, which creates an entity called psychosis. But psychosis isn't an actual illness, but it occurs in a number of different mental illnesses or physical illnesses. For example, if somebody has got sepsis and they've got a burst appendix and they're sick and feverish, you might find that in hospital at night, they're feeling they've been kidnapped, that they've been replaced by somebody else, that the nurse is a policeman. That's also psychosis, but that can occur from a medical complication because of the chemicals that occur in the brain as a consequence of sickness.
I see. So, where does psychedelic-assisted therapy realistically fit alongside your conventional psychiatric treatment, rather than replacing it? Can the two coexist and use together?
Yeah, so it really, there's not one answer for all of them. So two points. Ketamine, which is the legal psychedelic, even though I don't want to confuse people, we call it a psychedelic, but again, we can compare it rather to cannabis in the sense that it's out of the pharmacological classification of psychedelics. But it is a very psychedelic substance. So that is safe with most psychiatric medicines. And often what happens is people have come to a point where they're on multiple medicines. And the reason that ketamine is indicated for them is because none of them have worked. So often if ketamine is initiated, it is done so with their medicine. And if it's the thing that makes the difference, ultimately, then the idea would be, in an ideal world, to reduce those other medicines slowly and just use the medicine that works. The second part of the question is, in South Africa, we have a particular system which is very sort of inequitable, as you know. And so when people are struggling, to access health services, we're talking, if we're going to go on to, say, for example, MDMA and psilocybin mushrooms or LSD were legalized in South Africa for medical purposes. The point is that you've got the models and the research has been done where you've got a 6-hour session or an 8-hour session with one patient and two therapists, which is very person-intensive and very expensive. And so it's very hard to try and understand how that would fit in a South African setting, to be frank. And so I think our challenge as clinicians is to see, is there an option for group psychedelic experiences? Is there an option for group psychedelic trauma work? And I think this is all very, very important to think about because, having been to a psychedelic conference in Berlin, which was the European Conference for Psychedelic Medicine, it was very clear that South Africa and other countries like ourselves had not been thought about at all. And it's very hard, unfortunately, to sort of put up one's hand and say, actually, what about us? We need a different model.
Yeah, certainly. So for someone who's considering this psychedelic-assisted therapy, maybe they're considering it as treatment, what should they know before pursuing it? What would you advise them?
Well, I would advise them, first of all, if they're thinking about it, to talk to somebody who works in the field and who works in the field who's got good working knowledge, obviously, of big pharma or regular psychiatric medicine, and somebody who also has a good working knowledge of the pharmacology and the effects of psychedelics. So the first port of call would be, I would say, a clinician who is trained in Western medicine and also in psychedelic medicine. So, yeah, I mean, there are lots of people who some of them are doing very good work, but unfortunately, they don't have the training which is able to sort of span both of those kind of worlds. And I think that's where some people don't get the best advice. That's why, questions like, can I take magic mushrooms when I'm on an antidepressant? Even if somebody's talking in a recreational sense, because those questions get asked. And one needs to be able to provide proper, honest, and safe information so that people can make informed choices and decisions.
Dr. Kevin Stoloff, you've really been insightful in our conversation this morning. Thank you for making time. He's a specialist psychiatrist. It's 5 minutes now before 12 o'clock.
Hanging out with Clement
on 702.
Let's walk the talk.